Hello, back again. We're going to talk about doing facial bones. Facial bones, again, same changing instructions, so everything from the neck up is coming off. For this positioning, we are going to start off with the Waters view. So just like you did it in the other positions as well, this is pretty common. We're going to have our patient go ahead and extend their chin up. I'm going to exit through her canthion, so I'm going to just move that up just a little bit. Again, no angle on this, so I'm just making sure everything is lined up. I'm going to make sure my patient's head is correct. We have light on both sides. I'm going to put the right marker on her right side, and at this point we are all set to take our exposure. Okay, so the next view for facial bones, we're going to go into a lateral. So same kind of thing, patient's going to bring their chest up against the board, kind of rotate their body just a little bit. Again, I'm picking the right side just because it's going to be easier for me to line up. Keep in mind that it will depend on if your person had any trauma or pain, more so on one or the other. Okay, so I'm going to check their inner pupillary line and also mid-sagittal. I'm going to just turn Lisa just a little bit more. Centering for this one, we're going to be halfway between the outer canthus and the EAM, and it pretty much ends up on the zygoma, so basically right on the person's cheekbone. So I'm just going to move this down a little bit. I'm going to move my marker into the light. And again, facial bones, we want to make sure we have the person's chin on there. Again, we do not need the top part of her skull. Everything from the EAM forward. Okay, at this point we can go ahead and take our exposure and get ready for our last picture. So the last picture we need to complete for facial bones is nasal bones. Out in the real world, yes, you'll do both laterals. In lab, we're only going to have you do one. I've moved our image receptor to tabletop. Also, I've adjusted so we're at 40 inches tabletop on your tube as well. You're going to have your patient, again, your choice of which lateral you want to do during lab. I'm going to have Lisa place her head down and on her left side, just again to show you and make it a little bit easier. I'm just going to move my collimation out just a little bit so you can see it. I've collimated very small for this. Again, nasal bones are going to be extremely small, so you do not need a large area. And basically look at the outline of your patient's nose. You need to get back a little bit, okay, into their forehead and also underneath the nose and back. I'm going to put the marker for the side that you're going to do. This technique, it comes out like a finger technique. So when you're setting your techniques, make sure you're not still set for an upright technique, for skull work, that kind of thing. It's going to be too much. This is just going to be a tabletop finger technique.